My name is Michael Hanley. I'm Head of Education for the Innovation Value Institute, and welcome to today's summer series webinar on open innovation. I'd just like to introduce our host, Joan Mulvihill, and Joan is going to expertly guide us through today's proceedings. So over to you, Joan.
So I'm Joan Mulvihill. It's really nice to be back here again. I did the first of these a few weeks ago, so thanks to the IVI for putting together another great lineup, and thank you all for registering and attending today. So as the guy says, we have a great lineup this afternoon. Open innovation is a really broad and yet applicable to everybody topic right now. And what I've always found great about it is the concept, and Martin Curley is coming on first, so he'll talk to this far more expertly than I will, because he taught me everything I know about it. When we talk about open innovation, just that concept of bringing academia, industry, citizens, government policy, all of that together in terms of how we drive innovation, and really excited at the breadth of opportunity that's being explored across the case studies that we've got today. So from health, retail and the food sector, all really important to us in Ireland here, but globally also. So I think it's going to be a really interesting afternoon, and I will try and keep us to time, which means I will not say much more other than to introduce myself as Digitalisation Lead at Siemens and a great supporter of the IVI and their work there. So without further ado, our first speaker is Martin Curley from the HSE. Obviously a huge issue facing the HSE these days, and loads of amazing innovation happening, keeping us all safe and well. And I'm sure Martin will talk us through some of the great programs that they've been running there. So I'm going to mute myself and take myself off video and hand over to Martin. Martin, welcome.
Well, thank you, Joan, and hopefully you can see me on my slides that I'm currently presenting. So in the next 15 minutes, I want to talk about how we can scale innovation faster for patient and population benefit using open innovation. And we've had a real opportunity to practice this over the last couple of months with COVID-19. So we'll move quickly through my presentation and we can see if there's any questions afterwards. One of the key tenets of the work that we're doing at the HSE for Digital Transformation is based on this quote by Ilya Prigogine, and he said, in an unstable, complex system, small islands of coherence have the potential to change the whole system. So what we are trying to do is to create small islands of coherence, and we have already got evidence that we've been able to change significant parts of the whole system. And Joan mentioned the idea of quadruple helix innovation, where we have government, academia and citizens, as well as industry working together towards a shared purpose. And it's remarkable the results that can be achieved. So our vision in HSE Digital Transformation, and we borrowed the metaphor from John F. Kennedy, we choose to digitally transform the Irish healthcare system, not because it is easy, but because it is hard. And our goal is to move Ireland from a digital health laggard to a digital health leader in 5 to 7 years. And the data is very stark. We very much are the laggard in Europe, particularly around digitization of our acute and community healthcare system. The primary healthcare system is actually well digitized, mainly by a company called Klein William. But at the core of our system are some real digital deficiencies. Fans of the Innovation Value Institute will recognize this capability maturity framework, and we've repurposed it for the Irish healthcare system. And essentially we want to lift 2 maturity layers in the space of 5 to 7 years. We want to go from where digital funding at the moment, it's about 0.8% of the HSE expenditure. The benchmark shows that we should be spending about at least 3% of our overall budget on health. So we're a factor of 5 too low at the moment. We want to go from a mediocre player to a European leader. We want to go to a managed portfolio of innovations, and I'll share our portfolio with you shortly. And we want to move digital health from where it's perceived as a cost center to where it becomes an investment center, and where if there's a marginal euro available, that it is deployed into digital health, because that's where the areas of highest returns are. I just want to define digital transformation just at the bottom of the screen there. It's coordinated digital change effort at scale throughout all aspects of the organization and ecosystem. So there's a journey that we're going to go on in Ireland where we go from analog to digital healthcare, and where we go from reactive healthcare to proactive healthcare. And some of the key things that we'll see is that we'll be able to bend the cost curve using digital technologies. We'll have a real-time health system. We'll have a system that's citizen-centered. And we have one where there is data-driven innovation, and that's going to be a key opportunity. So our strategy is simple. We have 5 vectors that we work on. We work on our digital academy, where we're using open innovation to deliver great quality education to Irish healthcare employees. We have an open innovation pillar. We have a digital labs pillar. We have a digital academy forum. And then we also work on digitization. So let's talk about pillar 1. The digital academy, this is the architecture of the digital academy. And just to highlight that the centerpiece of this is a new master's in digital health transformation that has been developed with Maynooth University, University of Limerick, and all of the other Irish universities. And Michael, who introduced the seminar, teaches one of the modules. I also teach one of the modules. But last May, we pulled together, about a year ago, we pulled together all of the professors who are active in this field in Ireland, and we co-designed a totally new course, a new syllabus for digital health transformation. And we're pleased that we have now 50 students on this master's program, and it's a very good example of open innovation at work. We wanted to create a world-class master's, and by combining the strengths of all of the professors in digital health in Ireland, we were able to come up with something that we believe is very much close to world-class. Another example of our open innovation is we're working with the Mater Hospital and using that as a digital skills living lab, where we're surveying staff, mostly nurses and healthcare assistants, as to their digital needs. And then we're creating a curriculum that is suited to them. And then we will replicate that across the country. So in terms of education, we're very much using open innovation as a tool to progress. Our second pillar is open innovation. And what we're seeing is a new primordial soup where we have government, industry, patients, startups, hospitals all working together to figure out new value propositions. And what we are trying to do, if we left that ecosystem unorchestrated, we'd get lots of good innovation, but much of it would be wasted. So what we've done is we've articulated an innovation agenda, which we call Stay Left, Shift Left. So Stay Left is about using technology to keep people well in their homes, whereas Shift Left is about moving people as quickly as possible from acute settings to primary care settings to home setting using digital technologies. And we get sort of 4 types of advantages if we're able to do that. We see costs of care reduce, we see quality of care improve, quality of life and clinician experience improve. And I'll give you some examples of that. But this next slide basically shows the same Stay Left, Shift Left, but it actually identifies, here are some of the companies that we're working with that are helping either people stay left or shift left. And I'll refer to a couple of these a little bit later on in my presentation. One great example of open innovation is a strategy we developed with a company called Patient Empower, which deals with remote management of COVID-19. So today there are more than 1,000 patients that are being monitored from home that have COVID symptoms and have avoided filling or needing a hospital bed. This was a solution that we pulled together very quickly with Patient Empower, who are based in the Digital Hub, an old haunting ground of Joan, and a company called Nonin, which are one of the world leaders in the production of Bluetooth-enabled pulse oximeters. So how this works basically is a patient who's diagnosed with COVID but doesn't have extreme symptoms is sent home, and every couple of hours they're prompted by their phone. They download an app and they're prompted by the phone to look at their oxygen saturation level, and this is uploaded to the cloud. If oxygen saturation drops below, I think 93% or 94%, then an alert is generated and the clinician is actually phoned, and a decision is made whether to bring that patient into hospital or whether you wait a couple more cycles to see if oxygen saturation level deteriorates further. Oxygen saturation, other than respiration rate, is the first thing that actually starts to deteriorate if a patient is developing severe COVID-19 symptoms. So this is a very good example of open innovation at work. We discussed the concept with Patient Empower, who were providing monitoring solutions for post-lung transplant patients. But in 10 days, we went from a concept to actually a working product that, as I mentioned today, is being used by more than 1,000 patients with COVID-19. Our digital labs, I previously worked with Intel Labs, or led the Intel Labs team, and we're trying to replicate that in HSE and in Ireland. And today we manage a portfolio of over 50 digital programs and projects. And we try and progress ideas from a research phase to a pilot phase to a demonstrator and to broad adoption. And we're starting to build out this network of living labs. So for example, in Cavan General, we have a living lab that is focused on vital signs automation. We're hoping to stand up a living lab in Galway for vital signs automation. We've work going on in Limerick using artificial intelligence to shorten waiting lists and so on. We have a pilot about to start in Wexford General focused on using 3D cameras to remotely manage wounds. So that's our tissue viability pilot. So the concept of living lab is a key component of the Open Innovation 2.0 paradigm, and we'll be seeing more and more of these projects getting up and running in the next quarter or two. We have a whole pipeline governance, innovation pipeline governance process for all of these ideas. I won't go into it, but we manage the portfolio. We're looking at the doability of projects versus the benefits. And here in the top right-hand corner are some of the top performing or highest potential digital innovations. So there's a few that we're specifically focused on: vital signs automation, radiology at home, and connected medicine. I'll just give some quick examples. So today, hospital wards are very unautomated, and there's something called the early warning score, which is computed on a handwritten sheet. And this basically determines whether a patient needs escalated care or not. But in a trial of this automated solution in St. Luke's in Kilkenny, the manual system, which is the system of record across the country, was showing greater than 50% errors in the computation of the early warning score. So this is a solution that automates blood pressure collection, temperature collection, and so on, and then digital calculation of the early warning score. And this reduces the errors to zero. And all of the early warning scores are displayed in the central nurses station. And I was recently in the Bon Secours Hospital in Galway and talking to one of the ward managers there, and she said this system isn't just safer, it's way safer. So one of my key goals and our key goals is to implement vital signs automation across the country. We've just been awarded funding from DEPR, the Department of Public Expenditure and Reform, and we're going to use that to hopefully stand up vital signs automation demonstrator in University Hospital Galway. We're also working with a company called Health Beacon, and Health Beacon basically is deliver a connected smart sharps box, and that box basically once a patient, it reminds a patient on a particular day when they need to take a high-tech medicine, and it closes the loop with the clinician, showing that the medicine was taken. On the early trials with this system, the adherence rate for high-tech medicines, which are hugely expensive, is about 800 million spent nationally or annually for the country. The adherence rates went from 50% to 70%, which was a very significant result. And today there are almost 3,000 health beacons in use by patients today. So somebody who's taking Humira for rheumatoid arthritis would be on this program. So we want to drive, we're working with PCRS to drive the implementation of this system nationally. Another innovation that we're hoping to drive is mobile X-ray for nursing homes and private homes. So instead of taking an elderly patient out of the nursing home and bringing them to the hospital to be X-rayed, and it involves 2 ambulance transfers, it probably requires a nurse to travel with them. This involves bringing the X-ray equipment directly to the patient in the home, and it's a very cost effective. I think the cost is about €175. So we're trying to figure out, we know how technically how to do this. We're trying to figure out how we integrate this into the complex payments system and who actually pays for the X-rays. But in a test of a living lab test of over 90 patients, almost 85% of them avoided further transfer to the hospital because their X-ray showed up that there was nothing wrong. So what we're seeing for each of these, and one of the things we're hoping to work with the IVI with, is building a set of value dials for the healthcare system. So this is showing the value dials for the vital signs automation. We see that the error rate goes to 0 for the early warning score through implementing vital signs automation. We see the amount of escalations to ICU goes down. The average length of stay goes down. We have staff productivity go up, patient welfare goes up, ease of use goes up, bed capacity goes up, deterioration, patient protocol goes up, and cost saving avoidance. So one of the things we've just started exploring, working with IVI, is if IVI can help us actually monetize these and be in a position to help us build better business cases for the various projects that we're going to drive to broad adoption. I'll finish up shortly. I want to mention our Digital Academy Forum. Our Digital Academy Forum is something that we have set up. We try to run it once a quarter. We've had to temporarily postpone this quarter's and last quarter's event because of COVID-19. We'll probably take a leaf out of IVI's book and actually run a virtual one soon. But we've had Michael Hardy, who is chair of the Oireachtas Committee, speak at this. We've had Paul Reid, our CEO, and lots of other distinguished people. And we're delighted with the gender balance. The last digital forum that we ran, we had a huge concentration of female speakers. Lucy Fallon Byrne from Deeper, with several of the hospital managers, Lucy Nugent from Tela, and so on, and Gráinne Courtney, the CCIO at James's, with Lorraine Smith from the Digital Academy. Our last vector is digitization, and this is actually doing real life projects using digitization. And one of the key technologies we use there is robotic process automation. And we recently, earlier in the year, ran a forum in association with Deloitte and Deeper, and we had about 60-70 attendees. And I'm delighted to say that robotic process automation is now being used for some of the labs testing for COVID-19, and that was something that was spun up very fast. And it essentially allows, or we've again used an open innovation configuration where the project was done by Deloitte in collaboration with the HSE, using UiPath as a vendor and funded by Deeper. So it was an unusual open innovation 2.0 configuration. So we're looking at using RPA in different parts of the healthcare cycle: patient access, consultation and care, revenue cycle, and for supply chain management. So I want to finish by actually making a point that this is from a great report, Healthcare in the 21st Century. One of the key findings from that is that the key barriers to building a 21st century health system are not technological. They are in the institutions, processes, and workflows forged long before the digital era. And when we think about Open Innovation 2.0 and the ecosystem at work, the past, operation had many organizations working in silos, but the future of healthcare is an ecosystem-driven approach. And if Ireland is to move from a laggard to a leader, we actually have to have the whole ecosystem move with us. And I'm really pleased to see the amount of support we've got from industry, from academia, as well as government and citizens aligning around our message, stay left and shift left. So what we've been applying the principles of Open Innovation 2.0, and they've worked very well for us. They've worked very well for us, particularly in COVID-19. But we do know there are tremendous barriers. There are a lot of people in the healthcare system. There's a lot of very dedicated people, but there are people that actually don't want change and will do anything to block change. And we somehow need to get around those. And there's a saying that talks about, you can't change the system by incrementally changing what's there already. You have to create something that's much better and people actually commit to it rather than comply with it. So let me stop there. If anybody has a question, they can certainly email me at martin.curley@hsc.ie, but I'll hand you back to Joan at this stage.
Thanks a million, Martin. That was great. I'm sure we're going to have loads of questions at the end and loads of opportunity for discussion. I know I've been making loads of notes, particularly around words like moved really quickly and spun up very fast, words we don't often associate with the HSE. So obviously the work that you guys are doing there is having a huge amount of traction already. But as I say, loads to discuss, and thank you for that. So if anyone wants to ask any questions, just pop them into the chat at the bottom, and we'll come to all of them and do a collective panel at the end. But I am now going to move on to our next speaker, who is Evelyn Moynihan from the Kilkenny group. Evelyn is marketing, e-commerce, logistics, basically keeping that show on the road. Obviously, all of us know the Kilkenny brand, and have been at the forefront of e-commerce and digital for years in terms of e-commerce in Ireland. And I would certainly remember them very, very well as award winners in the Irish Internet Association Awards and Spiders and various other. So obviously ahead of the march on a lot of retailers in Ireland, but no more than any others. For the last quarter has been particularly challenging, and I know Evelyn is going to be just brilliant in terms of sharing the kind of innovations that they've had to adopt in the last while as their business continuity and dealing with disruption. So Evelyn, over to you.
Great, thanks Joan. Again, can you see my slides and hear me okay? Just checking.
We can see your slides, we can hear you perfectly. You're
great, thanks Joan. Great, so thanks very much guys for the opportunity to present to you today. I'm going to cover off a bit of background about the story of Kilkenny and what we stand for and what we're all about, and spend a bit of time just describing, I suppose, the current landscape and how COVID-19 has impacted our business. I'm also going to talk to some of the, I suppose, most recent consumer insights that we're hearing from our shoppers and from the marketplace that is very much directing, I suppose, our focus over the next while. I'm going to also talk to the importance of e-commerce. It was always high up our strategy and our agenda, but it has never been more important as we've, I suppose, witnessed and gone through the impact of COVID-19 and as we emerge out of it. And then I'm going to share at a high level some new innovation projects we're working on and pursuing with Maynooth University and IT3. So just a bit about Kilkenny and who we are. We were set up by the government in 1963 as a platform to sell Irish design and craft. And initially there was 2 locations, one in Kilkenny Design Centre, Kilkenny City, and the second one in Nassau Street. So we're very proud that our heritage back in 1963 is very much alive and well in our business today. Our business currently is represented by 17 shops, 5 restaurants, and 1 online site, kilkennyshop.com. And I'm going to spend quite a bit talking about our omni-channel plans and focus in a bit. Prior to COVID-19, we had 350 employees in the company, and we're very proud to say that 72% of what we sell is Irish designed and Irish made. We actually have an ambition for that number to be 80% by 2022. Our business is represented by tourism, hospitality and retail. So again, if you think of the impact of COVID-19 and the impact of the pandemic, it's been huge for our business and for our sector. And we're very proud to say that we're very much an omni-channel business, and I think that's going to be key to kind of future growth as well, how we work all our channels very hard together as we move forward. So to summarise the impact of COVID-19, we temporarily closed our shops and restaurants on the 16th of March, just before the advice came from the government. And again, like many businesses and like many sectors, it was an extremely difficult day for our owner and CEO, Marion O'Gorman, and for the business. So obviously that changed our business overnight. And since then, we've been growing our online kilkennyshop.com and actually a new channel called telesales, which I'm going to reference in a while. And we've been doing that with good success. Majority of our online sales comes from Irish customers, yet we're very keen to grow our business overseas, and in particular now where international visitors can't actually visit the island, or won't be, I suppose, this year, and it'll be slow to recover again next year. I mentioned our new channel, telesales, and it's really interesting where we've a lot of shoppers ringing up and looking for advice, particularly for gifting. There's an awful lot of gifting going on. Nature and goodwill and not being able to get out and see people and meet people is driving a lot of online gifting, which has been really good for our business. But people are ringing up telesales and ringing up our customer service team, looking for advice and doing purchases over the phone, particularly the cocooners. And that's actually been a new channel that's gone from strength to strength each week while we've had our shops closed. We're very much in planning mode at the moment, where we're opening, thank God, some of our smaller shops from the 8th of June next Monday. And a lot of the rest of the locations will open up by the end of the month. We're also doing takeaway in 3 of our restaurant businesses. And I suppose when we look at the outlook as well, we're expecting a big impact from kind of no tourists. I mentioned we're staying very close to Fault Ireland on the outlook. And as well, that'll be challenged into next year. And again, obviously, when we do open up our restaurants, there'll be need for social distancing, and that'll be very challenged for the restaurant side of our business in particular, which relies a lot on volume commercially. So we know at the same time, this is kind of my doom and gloom slide. We know the challenges that are there and the impact it's had in our business, but it's so important we stay positive and that we keep our teams very much focused on the road to recovery. So before I talk about some of our areas of innovation, which is obviously the theme for today, I just wanted to touch on maybe some of the key trends and consumer insights that we're seeing coming through. So obviously there's a huge surge in omni-channel growth that was very much there pre-COVID, but I think it's never been more important now that businesses are lining up their omni-channel strategy going forward and very much considering how bricks and mortar works with channels like telesales, works alongside click and collect, works alongside obviously e-commerce channels as well. So we're going to talk a bit more about that. Very much everyone's home is their castle at the moment, and I'm sure we're all living it, where lots of us are working from home and studying from home. And we're thinking about how do we create an at-home spa experience in our bathrooms? How do we create fabulous, places of rest in our gardens? So we're seeing a lot of purchases coming through our site that very much reflects, I suppose, people's wants and needs to improve their home and to improve various rooms around their house and kind of bring new experiences now that they're spending more time at home. And again, that working from home, we do believe, will be here to stay in different guises for lots of different businesses. Obviously, the country will be in a recession, and every business needs to consider that. So the need for customers to seek out value and offers and deals will be really important as well. And it'll be here for a long time, that sense of seeking out value. I mentioned cocooners already, and look, we are very conscious they're great shoppers in Kilkenny, very loyal to the brand, and look, they're going to be slower to emerge, and getting that confidence back will be slower for that group. So again, businesses and brands need to be considering how they're going to look after them and mind them. Bricks and mortar will go through its most challenging period, we've no doubt, over the next number of months and years. So it has to require innovation, and I'll touch on that a bit. Sustainability has been key, but it will remain key. So this idea of doing the right thing, shopping in the right way, backing local, supporting communities is going to be critical. I mentioned how workplaces will change, and I've touched on the tourism factor as well. So coming to our e-commerce, it has been our only channel open since the 16th of March. And we're delighted to share with you that we have seen growth levels of 310% since that period versus last year. Again, our online site has over 250 Irish designers and makers. A lot of these makers are very much reliant on Kilkenny as their big retail partner to keep, I suppose, their businesses afloat and their sales going as well. And we're very conscious of that. It's not just about our businesses, it's all the designers and makers that we work closely with. We will see our e-commerce business go this year from 5% of our business to 15% by the end of the year. And obviously that's a significant change. I heard recently this expression of we've gone through a decade of change in 2 months, and we're very much seeing that pace of change and decisions being made and teams being lined up. Our warehouse, which I'm actually up in the office here today, went from 8 people to 18 people within about a week. 10 days. So that kind of level of change and action, I think, has been a really positive thing, actually. I mentioned the new telesales channel, which is growing, and we're going to look to how we further digitise that, and I'm going to touch on that. And then I'm also going to just touch on some of the innovation we're working on. We had started a project with Maynooth University in Tralee, and now the importance of that is, I suppose, more important than ever, now that we've gone through the pandemic and we're emerging out the other side. So one of the areas that we're working with Maynooth University on is the whole area of how we use data to drive new insight and new revenue. So we're looking at the lifetime value of the customer, and we're looking at their interests, their needs, their channel and their marketing preferences. Like a good practical example to bring this to life is we've lots of very avid Orla Kiley fans who shop across everything Orla Kiley. And again, they should be the group that experiences firsthand any newness from the brand, any offers, any promotions. And it's that type of thing really, I suppose, tapping into what each customer segment is looking for and serving it up to them and making life really easy for them, I suppose, to engage with the Kilkenny brand. We're also within this watching customers who, for example, are abandoning carts, or those who are browsing and are, I suppose, jumping off the customer journey at particular moments, and kind of understanding that further and improving the customer journey as we go to overall improve the customer experience. Again, I'll mention again, we're delighted to be working with Maynooth University on this and with Marcus Helford and his team. And we're looking forward to real exciting innovation and new thinking coming through this work. Another area of innovation that we're pursuing is the remote salesperson, who's a real person located in a physical shop, who's available for service to the customer for advice and help in selection and purchase of products. We've been doing this in a manner during the summer with our colleague Susanna in our Cork store, who's been highlighting great gift ideas and promotional offers and going live with them via Facebook and Instagram Live. And then customers either ringing up or they hop on our site to purchase the item. We're looking at booking time slots for appointments also with our customer service teams, and we're starting a trial of appointments in our trim shop in July. This whole area has great potential for growing revenue in Ireland, and as you can imagine, it's got huge potential for us growing revenue overseas also, where again, some of the visitors who planned their lifelong trip to Ireland can't make it, but they can of course engage with a fabulous piece of Irish design through kilkennyshop.com. Another area that we're working on with the universities is this whole area of virtual and augmented reality. And I suppose before I get into that, I just wanted to kind of reference omni-channel retailing. I suppose, where the operation of the physical shops needs to work seamlessly alongside the retailers' online platforms. We believe services like virtual reality and augmented reality will be warmly welcomed by customers across all sectors. I mentioned the area of physical stores will remain important. We know that, but customers will be thinking safety first, along with the need for strong and empathetic customer service, I suppose, from our people to our shoppers. So more digital experiences, we feel, will be needed in store to help bring the offer forward and to attract more people across the door. So areas like click and collect, bringing experience to life better in store will be important. But equally, the whole area of virtual reality is going to play a key role, where consumers can experience a tour around our shop from their couch, and they can shop items as they go. And we're also looking at augmented reality, where you can see what a Foxford throw might look like in your sitting room before you purchase the product. Again, this is a super way for us to reach out to customers both home and abroad. So watch this space as we review this over the coming weeks and months with the university teams. So while I'm on today, I also wanted to speak about some work we're doing with some of the key industry bodies. I suppose our last speaker talked about the need to kind of work, cross-functional and work wider with groups. Like, we can't go this alone. So we're very much reaching out to the industry bodies to help revitalise our sector as we emerge from lockdown. So we're working with bodies like Retail Excellence, Chambers Ireland and the Small Firms Association to help recover stronger. So it is going to be a slow and challenging recovery, yet we will work closer together to emerge stronger. So what you see here is a marketing or campaign concept we're developing under Champion Green, which is all about when we support each other, we rise. And it's represented by a beautiful Irish green butterfly symbol. We delivered a very strong campaign last November in Green Friday, which encouraged shoppers to shop Irish and local on the run-up to Black Friday. So this is a natural step forward for the industry and for our consumers. It's never been more important to support each other and back each other. And I suppose I'm asking you all today as consumers to very much watch out for this campaign, pledge your support, but big time support local over the coming weeks and months as Ireland opens up on the high street and in communities around the country. So in summary, I mentioned it's been a decade of change in a couple of months. Definitely a changed customer and a changed marketplace will mean a changed Kilkenny. And I think all brands and all businesses need to be thinking in this way. It's never been more important to invest in e-commerce, in particularly getting the right people with the right skill set and the right infrastructure in place so you can scale up to capitalise on this opportunity. We are so grateful and looking forward to our innovation project with Maynooth University and IT Tralee. It's never been more important to us, and we really look forward to driving huge success from that for the industry and for our customers. So it's going to be a tough year ahead, but we really do need to stay positive. And my kind of last comment to you would be to just remember to support local and that we're all in this together. So thanks.
Thanks so much for that, Evelyn. It's a really great story. And, one of the things that strikes me most is you talk about an increase in sales like that. It's one thing to have it, which is great, but it shows just how ready you guys were, that you could scale operations to deal with that. A lot of businesses, they see that kind of rise in online shopping and everything keels over and services compromised. And clearly you guys have dealt with that really well. So it's a brilliant story. And lots of innovation coming down the track from you guys too. So I'm sure we'll have loads of questions at the end, but thank you so much for that. And without further ado, I'm going to move along now and introduce my next speaker. Just realized I didn't even have my video on, but anyway, you don't need to see me. Our next speaker is Matthew Mullarkey, Director of the Doctor in Business Administration at the University of South Florida. And again, I know that Matthew, like Martin Curley, doing huge research and innovation in the health sector, but specifically I know, Matthew, that you guys have been doing some really interesting work in relation to COVID-19. So really looking forward to hearing from you. So without further ado, I'm going to mute myself again and hand you over to Matthew. Thank you.
One, can you hear me? Am I still on mute? Okay, you can hear me?
Yeah, we can hear you, Matt. Yeah.
Okay, great.
Go
well,
ahead.
welcome to the IVI seminar here from Florida. And I just realized that if I had been, let's see, start my video. Okay. I just realized that if I had been really astute this morning, I would have been able to follow up Evelyn with a webinar 10 and get you all 10% discount at Walt Disney World or something, and make it worth your while to find a way to come to Florida and visit us. In the meantime, though, how about if I share a project that we've been working on here in South Florida with our local community, our local hospital systems, and our local governance, municipal and county governance, that is an open innovation project. It really does piggyback very nicely on the prior two presentations, particularly Evelyn's comments about the fact that in the span of a couple of months, we have seen the transformation activities that we have sort of begged for the last 10 years, particularly when it comes to data-driven approaches to public health. And so without further ado, I'll go ahead and share my screen. And hopefully you're able to see my slide presentation on Project Aspect.
Yeah, looking good, Matthew.
Okay, wonderful. Thanks for the feedback. Okay. Project Aspect is the idea that there is a way to look at anonymized systematic population level data to understand how a contagion spreads. It is looking at movement as a behavioral indicator of the spread of a contagion. I'll get to some of the privacy concerns and some of the overarching issues with regard to the security of the data and the information. But the genesis of this project was the fact that very, very early in this particular viral outbreak, we at the University of South Florida, working with our local hospitals and our local county governance, had a couple of really significant issues and quandaries arise related to what data was available about the spread of this virus in our particular region. We were looking at a number of models that came out of Washington University or Washington, Johns Hopkins, a couple of European models, the Singaporean, Korean models. And the problem that we found was that there was no model, no sort of universal model that anticipated the spread of the virus in our communities. In addition to that, we couldn't relate any particular behavior or viral spread to the actual intake and admissions at our hospitals. And we pretty quickly determined that the number one criteria for success in our case was going to be able to make sure that we had enough ICU and ventilator and other critical device capability or capacity for those patients that had this virus. All of that was a way of saying, wow, we don't really understand and cannot model what's happening. The second thing that we realized pretty quickly is that syndromic symptom reporting with apps, with websites, and with others was very, very biased by self-selection, to the point where we had small fractions of our community actually self-reporting, and we couldn't judge how well those small samples represented the population as a whole. And that led to an investment by Hillsborough County, which is one of the 3 largest counties in the west central part of Florida, in a project that we called Project Aspect. And we combined this with a comprehensive decision support dashboard approach to make it much more of a data-driven open innovation. I think it qualifies as an open innovation in that we are making sure that all of the information is represented and presented in public forums, that we have information that represents competitors and non-competitors in the marketplace, and that we do this in a not only a data-driven way, but in a way that shows both ethical and integrity in the results. So we started the project with this idea that we were getting ready to come out of our lockdown, and we've come out earlier than you. We've already been many weeks, almost 4 weeks into the phase 1 plan for reopening in Florida. Florida, as many of you know, depending on how you measure it, is typically regarded today as the 3rd largest, most populous state in the union at about 25 million people. The area that we represent here on the west central part of Florida is 13 counties, about 5 million lives. And on any given day, an average of about 5 million mobile devices that are active in that population. And so our key question was, as we come into the phase 1 plan for reopening, and we come out of what was a stay-at-home order, how would we measure the relative risk and rate of increase in movement, which would affect potentially the spread of the virus? How would we predict how that increased movement would affect outcomes, like testing outcomes and patient intake outcomes? And when would medical hospital capacity exceed our ability to treat COVID patients, assuming that the spread did occur and that it did lead to additional admits in our hospitals? And so we moved from disparate to comprehensive, try to look at the population as a whole, moving from descriptive to predictive and maybe even prescriptive. Where should we go to test next? Where should we go to geofence a particular area? And move from informative to actionable. And so we developed a capacity dashboard, a testing dashboard, and a movement dashboard that I'd like to show you. And we designed it in order to open, or not only open the economy, but answer the questions you see here. And so I do want to caveat this, that everything that I'm going to share with you is represented by mobile device data that is collected in a GDPR and CCPA, California Consumer Privacy Act, protected manner with opt-out capability. No HIPAA data is correlated with it, and no personally identifiable information. In fact, every mobile device piece that we have is hashed so that it cannot be associated with any particular mobile device, and certainly not with any individual. And then on the geofencing area, we went down to 100 square meter protected zones. So although we could have received data at 6 to 9 lat longs, we're receiving it at a much lower level of resolution, or higher level of resolution, depending on your perspective. So we can't identify individual addresses. The first capacity dashboard that we built is this one here, where we actually had a consortium of 7 hospital systems across the 13 counties and 5 million lives come together, and although they compete on a regular basis, they agreed to combine their data into one dashboard that would indicate the capacity for ICU beds and ventilators. It's a little bit of an eye chart, but on the right-hand side, you can see that here are 51 hospitals in that 13 counties. And on the bottom bar graph, you see 2 categories, ICU occupancy and total hospitalized COVIDs. And so you can see that as of the date that was here, basically May 6th, we had 392 COVID patients in those 51 hospitals, and we had about a 54.6% utilization of ICU capacity. And basically throughout the period, during the lockdown period, we call it, or the stay-at-home order, we averaged about 45% capacity utilization. Now, we also put into this a forecast. And this is an interesting forecast because what we recognized, as I said, was that none of the Washington or more generalized forecasts gave us any idea of what the actual bed capacity was going to be. And so we figured out that we had to really look at our demographics, our density, our movement behaviors, and our social behaviors. And we are looking at the behaviors of our population in all 4 categories. So one of the key demographic issues in Florida is that 25% of the population is 65 and over. And 85% of the inpatient intake in our ICUs for COVID are 65 and over. So to the extent that people who are 65 and over can self-isolate, we had an assumption that, or a hypothesis that we could remain less infected versus more. And it turned out that we had some evidence that people in that category self-isolated long before the governor demanded it. We also noted that density is an issue. So it's not just the number of different locations you might move to, it's also how dense those locations are in terms of number of people. And we then looked at the number of different locations per day. Here is the category or information with regard to the age. So 65 years and older, in terms of the characteristics of people in our cases, represented 26% of all cases identified, but 55% of admissions and 83% of deaths. Our testing dashboard was equally imperative that we pull it together. And so here you see the same testing data. Now you're looking at a particular area of the greater Tampa Bay. But again, what we were looking at here is the opportunity to truly understand where outbreaks and blooms of the virus were occurring. And you can see some of the hotspots and clusters, not just of testing, but test positives. And so the movement dashboard then tried to understand, if we could, how could we gather population level information on how far people traveled every day, what was the number of unique locations visited on average, and what were the number of dense locations visited, and how could we combine those into a risk score, essentially, that said, for aggregates of the population, say by, in our case, zip codes or geofenced areas, what risk was that particular geolocation facing from the mobility of its people? And could that score be related to patient and hospital intakes? So here's a map in March 18th, before our stay-at-home order. Red, the darker red being the more mobile, the particular area. On the left-hand side, you can see very specific geofenced zip code areas. On the right-hand side, you can see it by county. By April 5th, you can see that the heat map had gotten very cool. And that stayed that way through the entire stay-at-home period. So we essentially had, pardon me, March information, April information, and now May information. I'll show you that. We had interesting anomalies like April 22nd, and we tried to understand why the behavior during the lockdown period from April 5th to April 22nd had changed. And it was kind of an interesting activity in terms of the combination of communication from our local county governance, our state governance, and our national leadership. And so in and around this time frame is when our sister state of Georgia started talking about removing all restrictions. With our geolocation and our mapping, we were able to identify that that actually directly resulted in a change in behavior. One other analysis that proved very valuable is identifying where we just asked the data, where were there 150 devices in a 500 by 500 square foot area, basically 100 meters by 100 meters, in an 8-hour period. And these popped up. And so you see that a particular park, not all park, but a park in Tampa, had that kind of density. A particular beach over in Clearwater Beach, which also happened to be in the news from spring break times a few months ago. We saw a particular church. And what this highlights is that not all churches are violating the orders, but some are. And when they are, it would be nice to alert that to local officials so that they could go look at the area around that church, or the area around a particular furniture shop, or around a particular apartment complex, and make an assessment whether that was an opportunity for us to get out ahead of the potential spread of the virus with additional testing opportunities and or treatment facility mobile location in that area. The final thing in the dashboard, the movement dashboard, that became more and more interesting was the correlation between how movement dropped as a weighted average of population and how many devices were arriving at our local hospitals 14 days later. And we found a dramatic correlation if we offset it by about 2 weeks. And we're experimenting from anywhere from 14 days to 21 days and back down to 12 to see where the best correlations are. In the meantime, in our two major counties, Hillsborough and Pinellas, what is interesting is the blue line represents our local mobile carriers discussion of how average from 100% mobility dropped off during the lockdown period and how cases lagged. And so the total number of new cases lagged. They kept rising, rising, rising even after the mobility had dropped off, as you might expect. And then they began to fall. But quite frighteningly, within a week of mobility regaining, because our governor opened the first phase of return to work in the first week of May. Actually, Georgia opened it earlier, and you see that our mobility started earlier, even before our governor opened. And look what was happening to cases. The idea is, if you look at a macro score, you can calculate 3 mobility measures and put them together. You can have a before, a during, and an after. And you can see where particular counties and or particular zip codes are adding to the decrease, a 30% decrease from month of March to April, and then a 55% increase from April to May. And the consequence is that, I think I showed you earlier, we're averaging about 45% occupancy. We're now up over 60% occupancy in our ICUs. Total hospitalized COVID-19s are growing more rapidly and exceeding the averages. And here's a comparison of movement to admissions data. And you can see that it's quite frightening that our movement in a particular region, currently the hospitals are seeing sort of a flat admissions, but this would project that in the next 2 weeks, we are going to see admissions that'll grow from 60% to almost 80% of utilization. And infections rise with movement, and this is a linear rise, and we don't know if it's going to be linear. And this was an assumption across the state, but you see the wide range. The least impactful assumption is very, very low deaths. The most impactful is quite frightening and growing. And we believe right now that we're seeing in our region a trend that is in the upper quadrant or the upper half of this. And so with regard to that, again, we've managed this with all personal privacy protections in place. And we have an agenda going forward, and I'll wrap up there in terms of the open nature of this innovation. I'm going to have a conversation at 11 a.m. today. So at the end of this presentation, we're talking about moving this centralized dashboard into a neutral hosting environment at the University of South Florida. It looks like it's going to be funded by the top 5 or 6 hospital systems in our state. They're looking to present to the governor an opportunity to have USF be the host of this public health information, and really for the first time do it in a big data, data-centric, data-driven way, where we have an intersection of all the inputs related to mobility, environment, temperature, humidity levels, and we correlate that to actual demand on the public health system in terms of testing and admissions, as well as some of the symptomatic issues related to drugs and availability of pharmaceuticals as the progress toward treatments move forward. And the other thing is we've decided that we really want to understand our cluster of movement in and around our elder care facilities. We have something like 300 elder care facilities just in the 15 counties that we're talking about with 5 million lives. And what we have identified is that it's not the elderly who are infecting each other. It is in fact the staff and the workers who travel more or less frequently around the community who then traveled to the facility and managed to spread the virus. In spite of the fact that as of yesterday, 100% of all healthcare workers and patients or participants in the elder care facilities have been tested in the entire state of Florida. The truth is that's a snapshot of a moving train, and we need to figure out where to go next for the next testing, because we can't afford at this stage to test everybody every day. But we can afford to identify a mobility cluster effect where we can see an anomaly and perhaps send a targeted testing team to a particular facility, because it turns out that less than 5 facilities have contributed to over 85% of the admissions to our hospitals in the elder care, even though we have something like 300 in the region. Making this data-driven, centralizing the comprehensive dashboard, exploring key test parameters, and then posing tough questions that are community-centered. We're asking our mayors and our county officials to ask the questions. We're asking our hospitals and hospital systems and our test facilities and public health administrators to ask the tough questions. And then what we can do in terms of actionable, creating daily feeds to the officials, deploying mobile testing teams, deploying mobile care and triaging, and then automate this so that we can send alerts to key officials and use other data sets, syndromic, our contact tracing and our demographic data sets to help increase the predictive power and the prescriptive modeling associated with taking these dashboards forward. And I'd be remiss if I didn't share with you, sort of our cross-functional team, obviously heavily represented by researchers at the University of South Florida, but also our CIO at USF as a central neutral host support, Tampa General Hospital, who's been a massive participant in this process, our county administrators, Mike Merrill, Ramin Kuzakani, and Dennis Jones, our fire chief, and Jean Early, our health. And with that, I'll wrap up and just say thank you for the opportunity to share with you sort of our, 10 years? What'd you say, Evelyn? 10 years of transformation in the span of about 3 months when it came to public health in the state of Florida.
Thank you so much for that, Matt. I have to say that was just fascinating in terms of just how quickly you've managed to put all that data together and to have those actionable insights. There was a lot of data there, but it just, but actually brilliant and just shows all the different levels of correlation that, and different approaches that we can take to dealing with COVID or any such outbreaks in the future. So thank you so much for that. And I know there's going to be loads of questions. And of course, stupidly, my bad, I told people to put them in the chat when I should have told them to put in the Q&A, but I can already see that some have come through, which is great. So thank you so much. I'm conscious that you've got 55 minutes to get to your next meeting at 11. So we're going to try and get through our final speaker and our Q&A to get you on the road for that, or not on the road rather, just onto another call.
Another Zoom.
Yeah. Another Zoom. Okay, another Zoom, another room. Well, in another room near us is Gary O'Mara, who is the CEO of Meath Enterprise, but also the Managing Director of Boyne Valley Food Innovation Group. And again, a subject, as I was saying to Gary, so close to my heart as a farmer's daughter, for anyone who knows me. I'm obsessed with all things agri-tech and indeed food supply chain. So without further ado, I'm going to hand it over to Gary. I know you've been doing loads of interesting work there in terms of innovation in supply chain, particularly working with food producers, but also in terms of co-working spaces and helping and supporting businesses through all of this. So I'm going to hand over to you. Gary, are you there?
I am indeed. Thank you.
Well, I'm silencing myself and it's all yours.
Okay, thanks very much. And look, delighted to be here, and apologies, I don't have a presentation. So you'll have to look at me, and you may not have to look at me all the time, as I do tend to wonder as I talk. So what I'll try and do is give you some context as to who we are and what we do at a local and a regional level first. And then I'll move on to a much larger project that has kind of been born out of the pandemic. and helped us accelerate a lot of work that we've been working on, not just regionally, but also nationally over the past couple of years. And we've managed to get so much done over the past few weeks. So I'll talk about that in some detail later. So first of all, Meath Enterprise, the model. It's a local government enterprise development company. Basically, as a company operating on the fringes or just outside of the local government structure in County Meath, we would have a number of facilities. So in Navan, we would have 85,000 square foot, and that would be used to support startups, SMEs, clustering, kind of networking events, training, education, peer-to-peer learning, acceleration for companies, all sorts of different kind of support services and shared services, meeting room spaces and everything else, all the usual stuff you'd expect from an incubator. In Kells, we have an enterprise and technology centre with own door access and office-based kind of companies and SMEs. And then part of that project, which is something newer that we worked on over the past few years, is the development of Kells Tech, which is probably one of the largest co-working hubs in Ireland at this stage. We've close to 100 desks. We have a 128-seater auditorium for our kind of entrepreneurship acceleration and training programs, which we run a couple of national programs based out of Kells, and then obviously virtually online, which has been the case even before the pandemic unusually, but virtually online as well, for a lot of those companies around the country over the course of the year, in between kind of national meetings in Kells. And then we have a lot of innovation spaces and kind of training spaces and conference facilities, all supported by 500 megabyte or half a gigabyte broadband, excellent infrastructure, excellent security, and a great community, an opportunity for kind of companies, SMEs, multinationals, and everybody to really engage and network and work together, not just in the hub, but outside the hub. Another project that we're working on that's been mentioned is the Vine Valley Food Hub. So that's part of a larger food innovation district project we've been working on now for a number of years. And that would be, I suppose, in terms of open innovation, and I haven't really thought about what we do in that sense, but that is all about bringing public, private sector and academics together to develop an innovation district to support the scalable expansion of Indigenous Irish food companies into global market opportunities. We work with all the national state agencies and government department, relevant national state agencies and government departments in that project. It's government funded. We had been ready to hit the green button, I suppose, at the beginning of this year, after a number of years hard work and preparation to develop an actual facility which would incorporate food labs and kind of research space, incubation spaces for food companies, co-working spaces and meeting facilities and all the other shared services. And then that combined with, acceleration programs, training, peer-to-peer learning, education, and various other access to networks nationally and globally. A lot of that is on pause at the moment for obvious reasons. The centres, while all the centres and facilities are still open, they're for essential services, and we've had to keep them open for that. So a lot of the other spaces and co-working and everything else has been temporarily shut down, but we're hoping to start scaling back up and opening from next week. So that's on the food side. We're also close to launching a new remote working hub in closer to where we are in Navan, for those that don't know anyway, halfway between, we're 30 miles from Dublin city centre, the capital city, so Dunshaughlin will be halfway between where our main base is and our main facility, between there and Dublin city centre. And we're developing a remote working hub, probably 30-40 desks, but that's all about kind of, again, creating that community and that activity where potentially startups and kind of local people working for larger multinationals or corporates out of the city could base themselves with a blended kind of hybrid working model of some sort, which was always the case and something we were planning, but now it becomes even more relevant and more important that we get that project up and running in the short term. And they would be kind of the main hubs. One that's also on the offing is the development of a new digital innovation and smart agri hub, which is part of a European-wide project of developing digital innovation hubs in the food space. And that's all about bringing in technologies into the region and into the county. And not that it's all not there already, but it's really about linking the technology associated, or the technology that can support a lot of the food companies. And we do represent not just small companies, but very, very large multinational type companies that are in the region currently, who want to work with us and give back and help us package what they know and the access that they have into smaller chunks to support the development of a startup ecosystem around kind of tech-enabled food tech and smart agri-style companies. So the Digital Innovation Smart Agri Hub project is, we're actually working through planning permission for that. That's a 30,000 square foot state-of-the-art facility that we look to build on the site of the current major facility we have in Navan. And we look to bring in technologies like robotics and machine learning and blockchain and fintech and everything else into that. And then working that and combining that with the 85,000 square foot facility that will eventually over the next 5 years become one of the largest food hubs, specifically in the country, to see what potential kind of smart agri-food tech, agri-tech opportunities may come out of that. And we're in the process of working with public and private partners to explore options around development of an ag-tech, food tech acceleration program that will run in line with that. Also part of that project on the ground floor will be kind of social enterprise and community ecosystem development, in terms of making sure everybody in the community has access and has the ability to engage with a lot of the work that we're trying to do around food and food tech and the future of work and everything else, so that everybody has access and everybody has the ability to be part of what it is we're trying to create. And that's a very important piece for us in terms of diversity and inclusion and everything else within the community. So that's really kind of Meath Enterprise. As well as that, we run a number of projects. So, you know, we're government funded with a number of those projects. We're entering into a new joint venture with one of the leading kind of lab development companies, Lennox Labs. Some of you may know them. We're developing a food lab in one of our facilities down in Kells, where we will actually kind of test food product for SMEs and multinationals and startups to help them get access into those global markets. Our first protocol is really China. We're focusing on China for a number of years because we have some support and access with local companies to do that. So we'll be going after CNCA China dairy approval in the short term, because we helped bring a large multinational Chinese food company into Navan over the past couple of years, collaborating with national government, who will be developing infant formula for the Chinese market. And they are our first customer. So we're developing a lab to basically test and support them getting that product back into China. And then we're in discussions, or starting discussions, with other multinationals and larger companies who also will need to get access to China and other markets. So that'll be a fully fledged, fully operational food lab that will work alongside the work we're doing in Navan in relation to food R&D and new product development and everything else, which is to come as part of the project we'll deliver in 2020. So Meath Enterprise, I suppose that's in Meath, and there's a number of hub projects, and then there's a number of ecosystem development and innovation district type projects which really involve everybody, all different states. It's all about open innovation, I suppose, when I think about it, in that everybody has to come together and kind of feed into it. And we don't want to be replicating anything or reinventing the wheel anywhere. Really what we are, I suppose, is a conduit and an opportunity for everybody to engage, a reason to bring people around the table, because we've got majorly supported projects and exciting projects and a real ambition and capability potentially to kind of think big and have a long-term strategic vision for the entire county and the entire region in certain areas. And we want to bring everybody on that journey, so everybody is very much part of what we do locally. So about 2 years ago, I'm just conscious of time, so about 2 years ago, I was elected chair of a national association, which is the National Association of Community Enterprise Centres in Ireland, NACEC, N-A-C-E-C, with a view to taking that association of effectively entities like ourselves. So when you look at, we probably be one of the top tier, but there's many across the country in different sectors and in different regions doing what we do as good as, if not in some cases better. And there's many that probably don't do it as well as us, but could certainly learn and be educated and be funded and be resourced to get to where we are and to where others are in other parts of the country. So NACEC is basically that national kind of umbrella body for all of the different entities. And I suppose we're local government owned. You would have university incubators like ARC Labs and DCU and Bent and kind of, you know, the Maynooth Works are definitely engaging and supporting with us of late as well. The Regional Development Centre in Dundalk and many more. You would also have charities. You would have local community development groups where hubs would have been set up in disadvantaged areas specifically to support job creation or whatever. You would have creative hubs, food hubs, digital hubs. There's actually so many. And like the Chamber of Commerce, you know, in Galway would have the Galway Technology Centre and the Portashed in Galway, which is a hugely successful kind of tech startup development and innovation hub. One of our members also. So that national association, I took on the role as chair to really try and take a lot of what we were doing locally and we had learned how to do locally, but also capture and package what so many others across the country were also doing. And try and turn that into a strategic plan or a strategy for the entire sector, not just NASEC members, but the entire sector. Because over the past number of years here in Ireland, what we've noticed is that, you know, what would normally have been funded from the Department of Enterprise and Enterprise Ireland in terms of the development of enterprise centres and hubs in different cities and regions and counties. You know, all different departments now are involved in this, from rural, education, communications, who would have been involved for a number of years for the Digital Hub at the NDRC, but there's so many different departments getting involved in the space. There's so much opportunity in the space in terms of future of work opportunities and remote working, and technology has really enabled a lot of that, I suppose. So we've seen a real explosion of activity of new hubs and centres and projects, heavily government funded, popping up over the past 2, 3, 4 years. And we felt that, you know, there needs to be a strategic kind of plan and a longer term vision to make sure that all of that is aligned and all of that great work and all of those resources are connected in a kind of structured and hopefully longer term sustainable way. Because the mistakes that we know from ourselves, even a lot of the, you know, I'm not that long, I'm 2012, I kind of joined this space, but it's been around for the past 25, 30 years, enterprise centres and hubs. But taking it to the next level, I suppose, is our focus. So our NASEC strategy was launched by Minister Humphreys and Minister Bream back in October. And I actually spoke at the launch of the OECD report on SME and entrepreneurship kind of, you know, policy development and strategy development for Ireland. And that's something we were very heavily involved in. And our own strategic plan would be very much aligned to a lot of those recommendations, which will probably not come out now until the end of this year. But we were focusing on enterprising regions. Regional development is a big piece, from community enterprise, regional development, making sure that the different regions and the different sectors within those regions that are supported by our hubs, but also by not just the hubs, but the tenants within those hubs, and then the companies that we work with through many cluster projects and networking projects and events and training that are not members or not tenants of hubs, but are members and are aligned to some of the projects and initiatives that we run, open innovation possibly. So engaging the entire community and the entire region, and more, even in the Mideast, we do this very, very well. And it's great to have Maynooth University bang smack in the middle of the Mideast, supporting a lot of this type of work, which they have done, even locally in Meath, and they continue to support it. You know, even with NASEC and some of the bigger stuff that we're doing. So that strategic plan, enterprising the regions, very much aligned not just to recommendations from the OECD, but to government strategy and policy decisions that are coming or have come already. Climate change and sustainability is a big piece. If we're building these big monstrosities of centres and everything everywhere else, we need to have that in mind. We need to be bearing in mind that not just in terms of the sustainability of those facilities themselves, but the ability of those facilities to be able to help, you know, with government strategy and policy in terms of getting cars off the road and stopping those long commutes into Dublin. And this again is pre-pandemic, I suppose. This is the work we were talking about trying to do. Getting those cars off the roads and having kind of a structured and aligned way, all of government approach, I suppose, to using that national infrastructure of hubs to basically help with climate change and sustainability. I suppose, and the regional development piece. Then skills and digitization is a big part. So again, you know, when we work with IDA and bring in, so we've brought in some major FDI projects into Meath, great relationship with the IDA. Other centres in other regions do it well as well, but others don't. And they need to learn how, and they need to be connected in to some sort of a kind of connected structure or model. And our strategy is all about building, understanding what the skills are in different regions, not just in terms of the centres themselves, but the talent that lives in those regions, so that we have a first port of call for multinationals coming in that, okay, we've got software designers of a certain standard or whatever in a particular part of rural kind of Kerry, but we've also got a number of hubs that can do X, Y, and Z, and possibly that could be used as a launchpad. But we also have a local authority with the ability and the ambition to support that, working with national agencies to maybe build advanced technology buildings in local IDA parks or local authority on sites. Again, work that we've done locally ourselves and learned how to do it quite well. And then digitization is really important, and always was, always is. And like everybody else, I think we've all found that has been accelerated. Actually, most people who didn't think it was as important as it was, or didn't put the money or the effort or the resources or time or whatever into making it a number one priority, have had a real crash course when it comes to digitization and getting online and working remotely. And Zoom, we're all zoomed out, to be honest with you. Like, I find it very intense and all a lot harder, you know, working from home all the time, and Zoom and Microsoft Teams and straight onto the phone. You can never catch up on email. It just doesn't seem to be a break. But you know, everybody's in the same situation. So we've all had a bit of a crash course on that, and things have accelerated, or certainly the need for more digital literacy and everything else has accelerated as a result of this. Global ambition, organization sustainability, these things are quite obvious and quite necessary. And organization sustainability is very, very important in the sense that we've got a national infrastructure of hubs that can support startups, SMEs. We can support multinationals coming back into communities, not just to get the cars off the road and support climate change, but to interact with those startups, to get involved in local social enterprises that they wouldn't normally have the time to get involved in when they're sitting in the car and traveling in and out of the cities. So having quality standards, and we're working with NSAI, and we've effectively dealt and spoken, engaged with every government department, every state agency, all the major business groups over the past 2 weeks. And we had NSAI yesterday. We're working with them on developing a quality standards framework that would pretty much help us develop a world-class infrastructure for the entire system, or the entire network of hubs, with a view to linking that in then to every stakeholder, regionally and nationally, to allow us all then to kind of work better, work smarter. And we've done a lot of survey work and stakeholder engagement, and we're in the process working with governments directly to develop an action and a recovery plan that will give everybody an opportunity for their voices to be heard, and what's required, what's needed, what are the real challenges, and how do we work together, not to replicate what others are doing, but to work together to help each other do what's already happening. And I'll cut it off because I see somebody looking at me there saying, Gary,
sorry,
stop.
I think that's a good note to finish on, how we can all work together. So thank you so much for sharing that. It's good to know that there's so much work being done at a community level in terms of supporting innovation that's been done by business in Ireland. So thanks so much for that, Gary. I'm going to go to Q&A because I'm very conscious of time. Excuse me. The irony to cough in public. Okay, so can I ask our speakers if they wouldn't mind turning themselves back on to video so we can see all your lovely faces, and I can start directing questions to each of you. So I don't know if Evelyn, Martin, Matthew, you're all still there. Welcome back. My buddy in pink. We were getting a bit of teasing that the two women had incidentally or accidentally worn pink today, and the guys were all in navy shirts. So there was no memo sent out in advance. But we have had loads of questions. But before I just get into all of those, I just want to thank you all so much for your contributions today, and so many different case studies and perspectives on innovation. And as I said at the outset, a really, really particular topic that is open innovation, that idea of, you know, blending those elements of research with academia, but also government policy, also citizen engagement and industry, all of that together. And I think everybody has shown different examples of that in their talk today. So, and applicable to so many. So I'm going to go straight into everyone's questions. I'm going to start at the top of the list. To Evelyn, special one for you. The remote salesperson service sounds great. What has been the reaction response from your customers on this? I know I've seen it on a few websites recently, but just a very small number. Almost like that personal shopper experience, but online. Can you tell us a little bit about how your customers have responded?
Yeah, so we've been doing it in a limited number of locations over the last couple of months, and in general, they're responding really well to it. I suppose Kilkenny as a brand is all about friendly customer experience. So for a customer to ring up and to be greeted by, you know, very friendly, informed member of staff who can talk through various gifting ideas or talk through what the customer is looking for and follow it through to solution is really well received. So we're finding that in kind of commercial language, it converts really high. And it's really down to the people touch, this idea, people buy from people, they trust it in the voice, they can hear the expertise. So there's a lot more potential in that space, and it's how we further digitize it so we can show off the product on screen, and you know, how we can bring the senses to life, I think is what we're going to be working through with Maynooth and Curley IT in the project that we're working on at the moment.
I mean, it makes a lot of sense. I mean, you mentioned the cocooners in particular, and I suppose that's a lot of what we're trying to deal with in the health service as well. Whether it's the work that Matthew is doing or the work that that Martin is doing in the HSE here, it's this. There is the people who have been most affected recently. It's that more hand-holding care throughout this process, those touch points, making it as personable as possible, even though they're engaging, whether it's health service or retail services, through a slightly different medium. So even if it's, you know, GP visits now and you know, or people being able to do so much more of that over the phone or online, and it applies equally in a sales environment. And often we find that, you know, retail, it's such a personal business. I started my own career in retail. So to try and enrich those experiences in an online environment. Matthew?
I think to piggyback on that, one interesting aspect of the omni-channel approach that has existed in retail for a long time is that that same approach is now applying itself, I think, because of consumer behavior to all of healthcare. And if we really think about the omni-channel approach to healthcare, then we do have these cocooners. And Florida is one of the great states for figuring this out, because we found out through movement analysis that many of our most at-risk patient populations, you know, citizen populations, had self-selected to cocoon, self-isolate, maybe because they could or they just chose to, particularly in the elderly but mobile environment. And yet there weren't any significant public health support activities for that kind of omni-channel selection. And so one of the things that we're talking to our entrepreneurial ecosystem about is how to make the omni-channel activity more applicable to healthcare choice. And I think that'll be fascinating. And then I think you saw some of that in Martin's presentation as well.
Yeah, I have to say, I started my career in retail in Woolworths, and I always, of all the periods in my career, it was the time that I was closest to the customer, and it moves so quickly. And you know, Woolworths is very FMCG and very fast moving. But when you see how health service has to respond to that, and they are consumers of a service, and there's an awful lot to be learned that we can learn. And in fact, when we talk about data-driven decision-making and insights, retail had been ahead of the curve on that for a very long time in terms of how we engage with consumers. We always say, you know, retail is detail, or we talk about, you know, data-driven marketing. I said, it's always been data-driven marketing. We just have better data than we had before. So that granular level, those correlations, that understanding, retail has been using a lot of that for a long time. And you know, with the greatest respect to public services and everything that Martin was talking about, you know, in terms of what we're doing with the HSE, they are very, very large systems. They are huge ecosystems. There's a lot of layers of policy and politicking involved in those, and it is harder to turn that ship around or to make those cut-throughs. But when you have great data and you've got the cut through that you guys are making, Matthew, you can really see that while on the one hand, you've got Kilkenny Group selling beautiful Irish design, and then you've got someone else trying to sort out a global pandemic, the same principles of understanding customer and using data to drive innovation, to solve real problems, that still applies no matter where you are. So I'm going to go to our next question. It's fascinating to see what can be done. I feel like I'm on the radio and I'm Joe Duffy or something, and I'm reading out the comments. We've got a text in here. It's still fascinating to see what can be done, even with good privacy safeguards in place. I have to say that was one of the things, Matthew, that really struck me in your presentation is, you know, so often, and particularly in Europe, where you know, GDPR shares a birthday with me, it's 25th of May. GDPR is huge, and as soon as people started talking about contact tracing and mobile data, there was a freak out around privacy. And I said, look, I've got an organ donor app on my phone. I'm very happy to do a waiver on in the event of being diagnosed with anything highly contagious, feel free to knock yourself out and ring anybody in there that you like, that you think I've been in contact with. But it is about protecting anonymity and people's privacy, and the fact that you've worked around that and while being completely compliant is really, really important in terms of our capacity to scale these operations, not only in terms of how it's applied in Florida across the greater, you know, United States, but also in the rest of the world. I hope you'll let us share some of that and apply some of it here. Now we've got another, Evelyn, another question for you. And again, I think this applies to, I don't know if Martin Curley is still here, but how are you developing the capability of colleagues to take part in the innovation?
Yeah, like it's an interesting question. I suppose in Kilkenny, we're never short of ideas. Our own, you know, CEO, Marion O'Gorman, she's extremely entrepreneurial, and that's kind of the way the business operates. My biggest thing, and I'm actually from Musgrave as my background, I've been in grocery retail for quite a long time before I joined Kilkenny, is actually putting structure around it and managing the innovation and managing all the ideas. So for me, kind of the biggest space where we've stepped up is actually putting structure around getting the ideas through from our makers, designers, from our consumers, and big time from our staff, who I feel know so much because they're on the front face and they're seeing and feeling the customer all the time. So then it's about kind of funneling that in to prioritize. And it's very interesting at the moment. It's so agile and things are moving so fast. So it's literally on a regular basis going, right, what is in our roadmap for the next 3 months? What are the things we're going to prioritize that are going to give us the biggest gain? And then and keep channeling through that and keep managing that. And then also another big thing is trying things, and if you fail, just fail fast, move on from it. So we tried it, didn't quite hit the mark, right, we go again. And I also think innovation isn't all about digital either. I know now that's a big strong theme for us today, but some of the simplest ideas are more again about ways of working or people engagement, or there are other facets as well, I think, that constantly need innovative new thinking as well. So I don't know, does that help?
No, it really does. And it's my own fault. I couldn't see, Martin's face is not on my little lineup across the top, so I didn't. So I just want to direct actually the second half of that question actually to Martin Curley as well, because I think that you speak to a good point. It's not all about the technology, and I think one of the biggest things certainly in the HSE would have had to deal with and are addressing through the master's program and the academy is this idea of creating a culture of innovation, which starts with people, it's not with technology. So Martin, can I ask you to maybe talk to that a little bit? If you unmute, I don't know.
Yes, sorry, Joan, I was muted. And I think we had some fantastic presentations. Congratulations to all the speakers. So I think culture is hugely important, and you've probably all heard of the expression from Peter Drucker, culture eats strategy for breakfast every day. And one of the key things that we've done with our masters in digital health transformation is, rather than actually focus on educating CIOs and CCIOs as they've done in the UK, we've deliberately focused actually on educating our clinicians, our administrators, our procurement people.
Okay.
Okay.
Matthew, we'll go to you.
Yeah, I can complement that and say that at the same time, there is a tremendous hunger for this new way of thinking and finding new innovative ways of applying these concepts. We decided fairly early in the crisis that one of the things our College of Business could do is stand up a certificate on post-crisis leadership, 7 weeknights, 2-hour sessions where individuals could actually earn a badge and a certificate from the college. And we decided to make that available online for free.
Yeah.
Typically costs $3,000 to $3,500 for that kind of a certificate. We thought we might get 250 participants. Our first session, which I helped lead, had 9,700 online registrants. We blew through a budget because it costs us money to actually badge these people. Yeah. And every bit of knowledge, and by the way, 80 countries were involved, every one of the 50 states. And so the hunger is there. To Martin's point, people want this change. It is the leadership and sometimes the culture that the leadership has created through inertia and other activities that has to change. And the culture has to start with a function of leadership change. But again, I think this pandemic has given us opportunity to accelerate that kind of change. You know, there are a couple of cartoons that are out there that say, what led to digital transformation in your organization? Was it the CIO, the CEO, or COVID?
COVID, yeah.
And it's COVID.
And it's COVID. Yeah, I have to say, I see that even with work that I'm doing with customers. And so digitalization.
So there's a new normal that we can take advantage of.
People are no more than the work that Evelyn is doing, Martin and Gary, in terms of innovation. I think sometimes it takes something like this for people to press a halt, and they're less, in some ways, dare I say it, distracted by crazy day-to-day operational silly stuff that was taking up an awful lot of airspace. And suddenly you've got this clarity that you sometimes get in a crisis, that rush of, actually, I see now what we need to do. And previous old kind of boundaries of what aboutery and what about this and what about that, and then no, but suddenly is going, yeah, because if not now, when, right? So I think I think driving that kind of change and getting people to embrace technology, sometimes something like this can be the actual breakthrough point in it. And I think to maybe some of the work that Evelyn is doing in terms of Kilkenny, you have this opportunity. There's an awful lot of retail businesses who have not been able to do what you guys are doing. And I think for anyone who was resistant to change in Kilkenny up to now is suddenly realizing, actually, they know people who are working in other retailers who are now out of a job or who may not reopen. Kilkenny will, because you put those, that groundwork in place up until now. And I'm sure, Evelyn, your job in some ways, while gotten a lot harder, in some ways may have gotten somewhat easier because some of those barriers might have been maybe brushed aside with COVID.
Yeah, no, big time. And it's actually quite an exciting time. It kind of feels weird mentioning that word, but it is. It's very, decisions are being made. We're moving fast with new innovations, new ideas. I think you're right. I think it's kind of a lot of the things that were distracting us, or even people and culture, and people saying, oh, I'm not very technology, inclined, or I'm not very good at technology. Suddenly they're operating on Zoom every day of the week. They don't print it. They don't print a page. Like, they're reading off the screens. And I agree with Gary how hard and how challenging it is. You'd be exhausted after the end of every day, but we're after leaping ahead because we've been forced to, and they're never going to go back. You're right, Matthew. It's changed. People are changed. We've all had to embrace this new normal, and we're not going to go back. And it's just more about what when the country and when the world starts to open back up, you know, what will come back versus what won't come back. I think that's all to play for, really.
And speaking of coming back, I'm after, Paul is clearly keeping an eye on the time for you, and he's told me that you may have to leave. If you do need to go at any point, just pop off, and we will thank you in advance for all of your contributions so far. I'm going to keep powering on though and see if I have any other questions here. Matthew, what have you learned about engaging political leaders with a data-centric approach?
Yeah, well, it has been surprising. On the one hand, it's been encouraging, you know, and on the other hand, it's been discouraging completely. But we have had strong support from a number of what I will say are very clear-minded individuals in the county and the regional executives. You know, people who are full-time in the business of providing public health and or services to the community. And they tend to see things very clearly and want to be more and more data-driven. The politicians are, of course, playing, and I don't mean playing in a game-like sense, but they are actually, you know, the voice of their citizenry. And so we have found that in our executive emergency policy group, which is typically stood up every year for hurricane season and has now been stood up for COVID, we definitely have various politics at play. So we have been accused, and I say we collectively have been accused of violating the 2nd, 3rd, 5th, 11th, and 13th Amendments in the Constitution.
That's a lot.
We have, yeah.
And for saying that, broadband's got done.
Yeah, and there's a vocal minority of the population that's putting incredible pressure on their political leadership along those lines. Yeah. And so we have tried to be incredibly sensitive to it and incredibly communicative about it. And we're still not doing it well enough. I would think that that is probably the biggest thing that we've learned about being data-driven. It actually amps up the communication-driven side of what we have to do. And we're not good enough yet. We didn't really think it through in that particular sense and value the communications effort. And again, that might be one area where we could learn from some of these other omni-channel environments, right? The multiplicity of different ways we should be communicating with citizenry about why are we doing this? How are we doing it? What's the benefit for you? What's the benefit for the greater population? So we have a lot to learn.
Just call that, you know, your USP, you know, and actually communicating your brand values. And people don't associate public sector so much with that, with brand values. Exactly. Here's data, here's a proposition we have. We want consumers to engage and use it. Here's this lovely, you know, user experience that we've developed. And meanwhile, and I say this having worked in a university, in a research center in a university, it's a part about translating that research into something that works in the world in terms of how consumers engage with it. And let's be honest, in the end of the day, politicians are consumers too. So the same people you're trying to help, they're also trying to help, but they just, we maybe have to have a little alignment chat.
And exactly. And of course, you know, I'm translating between data scientists who say it's clear, it's evident, you know, and people should change their behavior. And political leaders and executives and county administrators. And part of that translation, though, too, is this is all very probabilistic, right? This is stochastic modeling. We can't predict with absolute certainty. We have to be communicating with ranges of confidence and levels of confidence or levels of risk.
And I think that's an interesting point when we talk about innovation and getting it from that idea concept to actually being implemented. And a lot of large organizations and public sector within that, we're always waiting for perfect. And we can't go live until it's perfect. And if we look at the born in the internet companies, they live their lives in beta mode. They've never released anything perfect yet, constantly updating, constantly, you know, everything has been evolving live. But when it comes to public services and, you know, large organizations, it's harder because there is that risk of, if it's not perfect, you're the one who's going to end up right across the front page of the papers, and there is an intolerance of failure or imperfection because it will haunt you for the rest of your life, you know. And I think the stakes are different. Whereas Evelyn, you can probably, or Gary, you know, the guys can launch a campaign, and we data test that, and we see, right, okay, this works, this doesn't, consumers respond to this, not to that, the price point was too high. But you're not going to get a complete beyond a cart abandoning scenario. And, you know, so there's that opportunity for testing. I'm conscious I want to check that I've not lost Gary too, because he's now slid off the end of my screen. Martin's in it. It's the IVI one is in there now. So I just want to check.
I'm still here.
Good. Thank you, because I do have more questions for you. Sorry. When you speak last, I'd end up going to the questions to the earlier speakers first. Professor Matthew Mullarkey, excellent presentation. Just a suggestion with respect to data for care homes. I don't think we should talk about the care home scenario. We've had enough of that here. Maybe you should examine the possibility of using naive Bayes approach algorithm. It might be appropriate. So there you go. If not already considered, I'm sure you have. Martin, where do you see the role of citizens' engagement in the digital transformation process? And I know, obviously, as you taught me what quadruple helix innovation was all about back in the day, that role of citizen engagement has been really important when you put up that model earlier on about, you know, how it's working with you guys and actually getting consumers of the health service to embrace new technologies. Where do you see the role, you know, going forward in terms of citizen engagement, or how has your experience been so far?
Well, one of the, you know, I mentioned the remote management of COVID-19 patients with Bluetooth-enabled pulse oximeters. One of the concepts that is pervasive now in healthcare is the idea of co-production. So it's no longer that the doctor has all responsibility for a patient's health. It's actually a shared responsibility between the health of, or between the person, the citizen, and actually the clinical team. And actually, in terms of all of the factors that influence the health of a person, you know, at most, kind of the traditional healthcare system is addressing just 20% of those factors. So more and more we're seeing, with the principles of Open Innovation 2.0, citizen-led innovation. One of the large ostomy product companies, they have redesigned their products by working with actually ostomy users, so people that would need a bag for their digestive system sort of waste, and that has turned out to be. So I think more and more we're going to see citizens involved in innovation. If I think about the semiconductor industry, over the last 40 years, 70% of the major innovations have come from the lead user rather than coming from a corporate lab. So in line kind of with the Open Innovation 2.0 and quadruple helix, I think, you know, any sort of research or innovation project that doesn't have a user or a citizen involved will be, you have dramatically reduced chances of success. And we have a very vibrant startup community in Ireland. And very often we see people that have a health situation they're trying to manage. They're so frustrated with the system, they actually start the initiative themselves. And CareFolk is one example of a company like that based in Cork. And the CEO there basically had trouble with care for his mother. And as a result of that, he started to develop a software app which shared medical records. And now it's a very effective solution, and I'd like to see it really adopted across the country. So I'll stop there, Joan.
You're perfect. That's funny. You mentioned earlier on my old stomping ground of the Digital Hub, and obviously I would have known a lot of startups in there in the health space, and it was always that, and they came from that very consumer. You know, they weren't big. You know, they weren't people necessarily who had a background in healthcare at all. They were technology people who were consumers who just understood a problem or dug into that and developed something that, you know, they felt, well, this is something I would use. But it was always that breakthrough to get the system to let you have a chance to test it. And of course, that's always the challenge with public sector procurement. But I mean, obviously, Gary, you'd see a lot of startups through Meath Enterprise and through the hub, and I'm sure I know some of them actually. I know the Navan area and Kells area quite well. I'm only down the road in Mullingar, but there is always that challenge of helping those startups get that breakthrough moment to be able to really test and trial what they're doing. And I think that's what's interesting about what you guys are doing. I'm assuming it's Wuxi is the Chinese baby food company that you're talking about in the Meath area. So, but like companies like that, large corporates collaborating and working with smaller startups, that really helps drive innovation forward and bring it to market, where otherwise, it's such a big challenge. And particularly when you look at the regulations, not that it's not as regulation in other sectors, but health particularly, if you look, even to get FDA approval, to get approval to be a supplier is so challenging. And again, you see that COVID has expedited that process for a number of organizations who are making those cut through now that they may not have made before. Gary, has that been your experience with startups, or? You're on mute. Unmute yourself quickly, or you're just on pause.
Yeah.
Unmute.
Yeah, no, absolutely, Evelyn. You're hitting the nail on the head.
Well, I'm told Evelyn's gone, but that's okay.
Sorry. Even nationally with NASEC and what the work we're doing at the moment. Look, it's always challenging for startups. And I think the engagement with multinationals and larger companies is really pivotal. But like probably most of our most successful startups have come or been born from a relationship or a career with multinationals in some way, shape or form. So getting back to a stage where we can facilitate that interaction and collaboration between the bigger guys and the small guys, so that maybe the small guys can provide innovative solutions for the big guys, and the big guys can help with that market access and all the other stuff that the smaller guys don't know. Like that's where we really need to be going. And there's a national infrastructure, but you know what? Everybody has said it already. Culturally, there's issues, and there always has been, communications wise, how we communicate. But right now, what I'm finding, I'm talking to ministers, I'm talking to heads of state agencies, I'm talking to everybody, and I am absolutely amazed how open and willing people are right now as a result of this. It wouldn't have been the case 6 months ago, and it might not be the case in 6 months' time. But right now, people are willing to talk. People are willing to change. People are willing to listen to potentially future opportunities where things can actually be better, and we can do things in a better way.
That's the point, and God knows politicians are always ready to talk. Sometimes ready to listen. And what we really want is that the people who are ready to do, and it's funny, it's a conversation I've been having myself internally in terms of, digitalization and how we drive that within industry. And Martin had it on one of his slides as well. And it is, and you've kind of alluded to it there, it's this ecosystem approach. And every time I look at a value chain of any industry, whatever it is, whether it's agri-food from farm to fork, or whether it's a distillery or a forest, whatever it is, there's a value chain there. And it all comes down to, do you understand what the consumer value is at the end, and where the opportunities are to disrupt within that? And it is 9 times out of 10, I cannot see it anywhere else. The disruption generally comes from left field. It tends to come from somewhere small. It tends to come from a tiny little explosion somewhere that sends ripples down that value chain. That's where disruption happens. It rarely happens in the larger organizations. And the reason it doesn't is large organizations are dominant. It's not in their interest to be disruptive an awful lot of the time. So, you have a choice. All companies, when they're looking at embracing technology now, it's that choice to say, am I going to be disrupted or am I going to disrupt? And who do you need to partner with, and who wants to support you to do that? And sometimes that means working with a larger organization to get you that foothold, to drive that innovation and support you through that. But, these kind of innovations, they don't happen in isolation, and you could spend your life banging on a door as a small disruptor trying to implement change. But it's just finding that cut through moment. And I think it was the quote, and I wrote it down, and I'm going through here. It was the very first quote that Martin put up in his. In an unstable, complex system, small islands of coherence have the potential to change the whole system. And I think that's what we cannot underestimate. whether that is that one nugget piece of data. That is the turning point for everything else. That's how you change a system. Because you know what? Maybe it's COVID that started this, that gets people to understand the value and impact of data. And if we can do this for COVID, then where are the other opportunities for data-driven decision-making and insights? Are we not exploiting in our health service or any of our education, whatever other transport service, whatever it is, we're missing it. And maybe now is the opportunity. This COVID is forcing us to acknowledge that data and those insights, that's what changes things. And you don't have to change the whole system. You just have to make one coherent case, and suddenly it ripples out to everything else. And that's my posturing done. I shouldn't be saying it as much as this. So I'm going to whiz back to my questions. In line with the current discussion and observing the broad range of statistics experts, oh, the word experts has been pushed in inverted commas, statistics experts, how do you touch the aspect of data understanding and interpretation? Oh, Matthew is waving. Is it that time already? It is. You have to go.
I have to go.
Matthew, I'm just going to
my apologies.
Questions. That's okay. Well, as the data expert, I'm going to let you go. Thank you so much for your time today. I really appreciate it. It was a fabulous presentation, and thanks for all your input on the Q&A as well.
I just wanted to, if it's okay, just to announce or just share what we're doing next. Sorry, let me just share my screen.
Putting this in the diary.
So our next webinar will take place on June 24th at the same time. We're still in discussions with some speakers on a theme, but we'll announce that shortly. We're hoping to do this networking event, which will be live now very shortly once I stop speaking. And you can find the link there, or you can find the link in the chat. We'd love your feedback, and we will distribute a questionnaire later on, just to get some ideas from you for future webinars, but also just to see how you found this. But I thought this one was absolutely excellent, and thanks to Joan for facilitating and to the speakers for excellent presentations. If you enjoyed it, please spread the word. That you saw a great webinar from IVI, and spread it through any channel you'd like. The slides and the recordings will be posted later on our central webinar page. The link is there, but you'll also find the link in the top right-hand corner of our webpage. And as always, stay in touch with us on Twitter and LinkedIn. We're there, and we also have a newsletter that you can sign up to from our website. So I'll stop talking and I'll open the networking session. And
thanks for having
Joan,
me.
if you'd like to say anything else then on top of that, that's great. And thanks again for facilitating, especially on your day off.
Yeah, well, sorry. Yes, I'm on holidays. Thanks so much for having us. It was a great, you put together a great lineup again, and it's just always a pleasure to hang with you guys and have such great discussion. So I'm going to go as well, but Gary, you and I are going to have a chat another time, because I do want to talk to you about food. Martin, lovely to see you again as always, and the other two are gone. But
thank you, Joan.
Thanks a million. Take care. Bye.
Bye.